So what is a care coordinator? So we're talking about this very much from the perspective of primary care now. So in about 2019, there was a document that came out which is about the GP contract, about employing different roles to grow the multidisciplinary team in primary care. And of that, one of the roles was a care coordinator. And as an alliance, we saw that there was a lot of opportunity to push forward because roles were kind of specialising in different areas like frailty care coordinators or long-term conditions or older people. And we thought, you know, that's a great opportunity. Maybe we can look at cancer care coordinators. So myself and Tamsin, if you don't know Tamsin's there, have been very much involved in the promotion of cancer care coordinators, getting PCNs to think about having them, and then hopefully looking at ways to support those roles when they come, when they're employed. Next slide, please. So what can a cancer care coordinator do within primary care? So you'll see there's a whole raft. We are seeing them work across from prevention right towards end of life. There are some that work particularly in the palliative area as well. So from that perspective, probably a little bit surprised because we thought they'd be very much just in the kind of pre-diagnosis end, because that's where all the money goes. I think you'd agree, Jane. You know, it's very much on the kind of faster diagnosis, early diagnosis. But what we have actually seen is they are used a lot in the personalised care part of the pathway. So we're really pleased to see how these roles are supporting cancer patients right through. So I don't know if anybody's surprised by anything that's up there, but that's kind of the raft. And I'd actually go to say that I wrote that about a year ago, that there's probably more that we can add to that now. So just as a bit of an idea to see, again, this was written only about 4 or 5 months ago, so this has changed already. But there we've got where people are placed that are working as cancer care coordinators. And when you're on your tables later, you'll get to learn about who's where in what PCN and share that information as we start to kind of asset map and kind of improve your networking. So when we ask them where they're utilised in the pathway, if you look at that on the right-hand side, you'll see that when we ask them that actually there is quite a good spread of where they're working across the pathway as well. So it's not really heavily into one area at all. We're seeing quite exciting stuff with projects being done, lots around kind of improving screening for people with health inequalities. We're seeing them look at different ways that they can improve by promoting safety netting tools. So there's a digital and data element to the role as well. And we're seeing that they are working towards achieving the NHS long-term plan for cancer. So assisting with holistic needs assessments or cancer care reviews that happen within primary care. And obviously, a bit like the cancer support worker, offering lots of information and signposting. And this for me is, you know, one of the things that I want to talk about, that I think that cancer care coordinators are really a role that we can look to help integrate for cancer patients, because we know when we ask patients, they don't feel particularly supported by primary care. And Sam, where are you, Sam? Who's just spoken? You sent me a lovely document, didn't you, where you'd asked the patients that, which was a little bit distressing. They really didn't feel like they'd been supported at all by primary care. So we think that's really sad. We want to improve that. And we as an alliance are finding it great that we can link up, that we can speak to cancer care coordinators, that we can give them information to share out between the people that they work with, because cancer's a small part of their workload, although it's all ours, and if you're a cancer care coordinator or a cancer support worker, it's all yours, but in general practice, it's a small part. So we just need to keep pushing, and having that person that we can go to share information, opportunities, training, resources, and keep pushing agenda is really important. But also we've got feedback that the patients are really appreciating that there's somebody there that they can go to that is a link. and they link into the rest of the primary care team via that person. We know they like one point of contact, and this can be really helpful for that. And I'm really great to hear, because some of the conversations we just had from the first lot of presenters, they are speaking to cancer care coordinators. So we're seeing that secondary care, the Right by You, being able to work together to help patients, because unfortunately every PCN is very different in its makeup. So what you might have in one, you don't have in another. But if you've got one point of contact to go to, you can find out if there's a social prescriber that can help, or a health and wellbeing coach, or an advanced clinical practitioner. There's lots of opportunities there. Next slide, please. And there, I just thought I'd end on a couple of testimonials that we've collected along the way. So one is actually about Rebecca, who unfortunately wasn't here today, but just gives you a viewpoint that they are very valued within primary care for what they do and how they bring things together. And just a little bit about Rebecca for those of you that aren't cancer care coordinators. So Rebecca works kind of for us as an ambassador for the role, because our cancer care coordinators are spread over lots of multiple sites and over a big patch. So having that one person to bring it together. Tamsin started a community of practice, and now Rebecca's taken that on, so it's now fully run by cancer care coordinators. And also Rebecca's been working to help with the supervision and training programs that the vast majority of our cancer care coordinators have gone through as well. So that's her role. And I think that's the end of my slides. Can I get a cancer care coordinator just to talk a little bit, even if it's just about what they like about the role?
Yeah. I spent 5 years working in secondary care, and then in a different county, made the leap to Hampshire as to work in primary care as a care coordinator for cancer services. And I was always conscious that in secondary care, we were really good at delivering the recovery package as it was then, but I'm not sure that I could have ever found a patient that knew that they'd had a holistic needs assessment, a treatment summary, a cancer care review, and all the things that we knew that we were really good at offering. So I thought, when I went into primary care, I thought, oh yes, this is a chance to join the dots. It's not that easy, but one of the first things that I thought I could do was help with the cancer care reviews, because the surgeries were doing them and they were ticking the box to get the quaff, but I said, are you doing them well enough? And they probably weren't. So I thought, well, I've got the time and the background, I suppose, to offer a better cancer care review. So they were really grateful, I think, that takes a lot of the pressure off the GPs. They still get the tick in the box and the money, but the patient gets a better cancer care review. So I think that was my greatest day. And they said yes. Obviously, there's lots of I know that some cancer care coordinators don't do that because they're seen as quite a clinical process, but I think if you've got the right connections with your GPs and your surgeries, then you can feed in the clinical queries and problems and deal with all the other things that you can signpost patients onto. So it's great. I love it. It's great.
And probably just to second that, what we've seen is that a lot of cancer care coordinators have come and developed the role that they want it to be.
Yeah.
They've been given a lot of freedom to do that.
Exactly. Because in the code of, what you call it, the community of practice, I've learned that there are no care coordinators that do the same job.
Exactly, it's very
Everyone
varied.
is different.
Yeah. Okay, I'm going to move on to the next one.
Perfect. Yeah, thank you very much.
Thank you.